All right. Hello, everyone. This is a Facebook Live directly from the operating room here, right across from the surgery center. So this is a 56-year-old female. You can focus here, please. 56-year-old female out of state. In 2017, she had what was breast cancer reconstruction with what are 700 cc silicone implants below the muscle. She had the left breast cancer. So as you can see, this is the right mastectomy scar. And I have oriented this at 12 o'clock so that this is the secure part, this is the big mastectomy scar. I contoured such that she's going to have a nice flat chest aesthetic closure. So she had the left breast cancer, so I did the right side first. Now as you will see right here, I removed the entire implant capsule. What is end block, total capsulectomy right side, the gold standard. And as you will see, this is part of that cartilage that was right on top of the rib. And again, another rib pattern. So you can see this was a very meticulous dissection, all done end block, so everything is contained. So what I'm going to do now is I'm going to go ahead and open this up. And this is just from 2017. You can come closer. So as you see, as I go in, you have an implant that is truly has a textured appearance to it, called contained. And as you will see, this is a ruptured implant. And so this is just 7, 8 years old. And you can see, look at the internal sutures that were used to hold the reconstruction together. You can see right here, very thick suture. So all of this foreign material was removed. Right here, as you can see, it's being weaved at the corner and the bottom. And as you go in, very thick capsular tissue. All of this inflamed tissue has been removed. So if you look at this capsular tissue right here, it's very thin. So removing this alone is insufficient. In my practice, I like to go ahead and remove all this tissue around and all contain end block, the gold standard. None of this spilled into the chest. You can actually see my blue glove underneath. And this is the trick behind doing it in a very defined, controlled way, such that, look at this, none of this spills into the chest. And so all of it is contained. I'm going to go ahead and put it down here, and you can see, look at this ruptured implant. This is, as you can see, the cohesiveness of it is not cohesive. It is your, I'm going to go ahead and look at this implant. As you can see, it's like literally stuck. You can only imagine the amount of inflammation that's present. So this is your 775 elephant, 775. So the biggest, the largest implant that we make is 800. And you can see, look at this. There is nothing cohesive about this, and you can see how the significant inflammation that was present around all of the tissue has been removed. Now I'm going to remove my top glove, and I'm going to go over to the left side, left mastectomy scar. And again, I'm going to go ahead and orient this upwards. So this is your 12 o'clock. This is the mastectomy scar. This is the midline that I'm going to send along with the left side because of the history of the left breast cancer, just to be certain. Remember, this is skin, but a mastectomy scar, so it has to be sent. And again, as you will see, 100% total capsulectomy. I'm very happy and content with how the whole dissection has gone. And I'm going to go ahead and cut this open. A lot of inflammation on this side, but not as much. And as you will see as I go in, this is your textured implant. You know, what's interesting is this is from 2017, fairly recent. And as you will see, a lot of inflammation. I had a brand new glove, as you saw. This is your secondary capsule that forms. So as I go in, I am going to go ahead and tease this off. And literally, with the finger dissection, we are able to tease this off. I want to send this off to pathology as well, along with that capsular tissue. So this is your 775 as well. So if you look at the fluid around, and I go like this, you'll see that the stickiness, that slime, this is consistent with what is the leaching of the silicone. And as I go and look at this, the suture, the heavy suture, It's right in the proximity of the implant. I don't like to see this. Look at this knot right here. How it basically will rub against the implant back and forth with movement and may hurt it. I don't like to see these. And you can see a lot of it was used to reinforce the anchor. And complete total capsulectomy, 100% right underneath the muscle directly on top. You can see my blue glove.